Start off tonight with a Valley News Live investigation. Healthcare facilities across the country are seeing massive staffing shortages, including here in Fargo, and it's taking a toll on the number of available beds for patients in need.
Sanford Health says it has 1,500 openings across its Fargo locations. More than 400 of those are for nurses. Valley News Team's crime and safety reporter Bailey Hurley dove into the problems plaguing hospitals in North Dakota and how officials are trying to triage them.
Hospitals have been dealing with capacity issues for 3 years now, but an influx of COVID patients isn't to blame for that problem anymore. Now, many hospitals have empty beds, but not the people to care for someone in them.
It's a real challenge finding enough people to take care of patients 24/7.
Dr. Briggs says during 7 of the past 13 days, low staffing numbers made Sanford unable to accept patients from other hospitals unless those patients were suffering from a heart attack, stroke, or serious trauma.
Nobody wants to turn anybody away. You do have to close those beds, even though they're physically unoccupied. That's different than saying, there's no ICU beds available.
He says while today Sanford's capacity was fine, that status can change quickly, as he says staffing shortages in other parts of the state can influence bed space in Fargo.
It is a hard conversation sometimes about, can we safely take care of that patient or not.
While Sanford is working hard to recruit more nurses, techs, and other staff, Briggs says healthcare is a different world now, as many are opting to do travel work.
It's very difficult to maintain long-term staffing when your labor pool is short-term.
He says while hospitals everywhere will continue to work on trying to accommodate the needs of the new generation of healthcare workers, rebuilding the workforce isn't going to happen overnight, meaning capacity issues are likely here for the long haul, too. Bailey Hurley, Valley News Live.
Dr. Briggs says Sanford often gets requests from Minneapolis hospitals, even hospitals in Nebraska, all in search of empty beds.
But Briggs assures Sanford prioritizes being a safety net for patients in the Valley versus other states.
Well,